Tamara Ugolini here with Rebel News. And what would Christmas in Canada be if vaccine-pushing propagandists weren't hard at work? As Health Canada and the Chief Medical Officer at the Public Health Agency of Canada tell Canadians that COVID-19 injections can be given at the same time as other injections, which counteracts the manufacturer's own safety disclosures in the product monograph itself, they're now exploiting Santa Claus and Mrs. Claus, a childhood favorite and classic, to push vaccine uptake with an appalling video targeted at children that features the beloved Christmas character, Mrs. Claus. And before I show you this ad, I want to know just how much it cost Canadian taxpayers. So please stay tuned and help offset the cost of filing fees associated with an access to information request, if you're able to, at rebelinvestigates.com. So let's take a look at this video, published, you'll never believe it, by the Chief Medical Officer at the Public Health Agency of Canada, that's Dr. Theresa Tam, who has been at the helm of Canada's COVID-19 response plans that have generated the hysteria needed to implement knee-jerk, harmful policies that are showing in real time to be causing grotesque harms to healthcare systems all across the country, destroying our societal fabric through dehumanizing policies like indiscriminate mandates, indiscriminate masking, and social distancing, destroying our economy with relentless lockdowns, closures, and stipulations on small businesses, and so distrust of government and divided many families whose members may have succumbed to the industrial strength mind control propaganda that's being pushed incessantly. And before I remind you just how much taxpayers have funneled into these campaigns and programs in the last 2+ years, let's look at the latest and greatest creation by the brilliant bureaucratic minds at the Public Health Agency of Canada. Check it out.
Well, kids, I'm just doing my yearly call to the North Pole for Santa's holiday health check.
Ho, 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 ho.
Why, hello, Dr. Tam.
Mrs. Claus, so good to see you again. Where did Santa go?
Oh, Santa was late for snow yoga with the elves and reindeer. He says it's great cross-training for sleigh driving.
Sounds fun. Are you all set for the holiday season?
Of course. I must say, Dr. Tam, it just warms my heart to see everyone in Canada, especially kids, working so hard to keep the holidays safe and cheerful for all.
So am I, Mrs. Claus. Every child in Canada has definitely earned a place on the nice list. Their parents and caregivers too. It's been a tough season with lots of viruses making people sick.
Thankfully, Santa and I are feeling as healthy as ever. We are both up to date with our vaccinations, including COVID boosters and flu shots.
That's so good to hear.
I always tell Santa to make a list and check it twice. 1, stay up to date on your vaccinations. 2, wear a mask in crowded indoor places and make sure it fits nice and snug. 3, wash your hands to the tune of jingle bells, jingle all the way.
Great advice. Great voice too. Also, you can be sure to stay at home if you're feeling sick. And if you're gathering indoors with other people or elves, open a door or a window for a few minutes at a time to let in some fresh air. The more items you check off the list, the more protected you are.
Yes, you can think of it like decorating a tree. You need tinsel, lights, ornaments, and the star on top. The tree is at its best when all the decorations are up and nicely layered.
Thanks, Mrs. Claus. Happy holidays, everyone.
Now, let me also remind you that Theresa Tam has a now scrubbed profile with the World Health Organization that I was able to dig up using the Wayback Machine at archive.org. It mentions that she is an expert in immunization, infectious disease, emergency preparedness, and global health security. Then it says, Dr. Tam has served as an international expert on a number of World Health Organization committees and has participated in multiple international missions related to SARS, pandemic influenza, and polio eradication. which led Canadians to wonder at the onset of the pandemic if she had conflicts of interest with the WHO throughout the COVID response, and was she really working for Canadians or with the China-centric WHO that is heavily funded by the Chinese Communist Party. And to note, the Public Health Agency of Canada that is spearheaded by Tam was responsible for spending $113 million to date for COVID-19 related advertising, otherwise known as propaganda.
I think regulation of social media platforms is the one that governments have been really engaged in, and that's quite a massive piece of space of regulation that is still undergoing debate.
Are you a Canadian taxpayer? Because congratulations, there is the payoff for all of your hard work since 2020. And of course, the propagandists could never let a good holiday go to waste. But from my family to yours, for the sake of your mental health and your sanity, please try to ignore this international embarrassment. Tune out the pharma drug dealers, turn off the propaganda, and have yourself a very Merry Christmas. For Rebel News, I'm Tamara Ugolini. As mentioned, we have filed an Access to Information request, otherwise known as an ATIP, to find out how much money went into this surreal ad. And if you'd like to help offset the costs of that investigation, please consider doing so and staying up to date as it continues at rebelinvestigates.com. That's rebelinvestigates.com.